pharma already has a great set of information. There are thousands of reps on the field continuously collecting data, continuously collecting information of what the doctor wants, what the doctor, and you really need to leverage that information.
Hello everyone, welcome in the 17th episode of the Mad Talk powered by Gameofpharma. Today we have with us a very special guest, Mr. Adarsh Rodrigues sir. Sir is the lead in multi-channel engagement and a omni-channel marketing expert, and now in the novartis Ex GSK and Ex Welcome on the show, sir.
Hello, Lokesh. Thank you for having me.
Uh, like first we have to starting with the discussion. I'm asking about your cover photo on the LinkedIn, sir. Like it's quite amazing when you are showing the multi channels of the digital marketing on your cover photo, sir. Can you tell us about something, your cover photo on LinkedIn, sir?
So I did that in haste, to be very honest. I was working on a multi-channel campaign. I think I updated that when I was at GSK, and we were planning a multi-channel campaign. And then I was going through my LinkedIn profile for I don't remember the reasons, but we were planning an email campaign, and then I went through my profile just to see how that channel works and how can engagement be better driven. So I went through and then I saw that there is no cover photo, and I thought me being from the digital marketing industry should not miss out on using as much exposure as possible, right? So, and then I wanted to go some fancy. I decided whether should I put my face. I thought my face was enough on my LinkedIn profile. I don't need more of my face. And then I thought what would communicate what I do well without words or without me having to explain to people what I do and where my expertise lies. And that is where my I think my LinkedIn profile cover picture came into picture, where I thought these are the channels that we use today in silos. This is the list of channels. So whenever we talk about digital marketing, people will always talk about all these channels, but in separate in silos. And I think the way ahead for us right now is to find out ways how we can integrate these channels, how these channels need to talk to each other, and then we create that seamless experience for our customers that I think Pharma has been aiming for last decade.
You are a pharma digital marketing expert. So, sir, I want to ask a question. Ki, why pharma is lacking for in the digital marketing or data sort of things compared to the other industry like e-commerce and travel? What is the reasons and how can we accelerate this transformation journey?
See, I think the biggest barrier that we have today is mindset, because a lot of discussions that I've had throughout my career revolved around convincing senior stakeholders on why we should go digital. I think that landscape has changed over the period of time. Today, it is easier to have those discussions. But when I started off my career in pharma digital, biggest and most difficult discussion was to convince in investing into digital. And people always had this reservation that whether HCPs would react to respond to digital channels, and there is a traditional model that has existed forever in pharma, and people were not sure how a doctor would respond to that. Let's say I'm sending out an email or running a digital ad, and nobody knew how well the doctor would respond to that kind of advertisements. My philosophy in that was always is that this doctor is also a customer to a bank. This doctor is also a customer to Zomato, or a customer, let's say, to any other digital, any e-commerce site, right? And you should ensure that you put your customer into that zone where he feels comfortable with interacting with you on a digital medium. For example, if a HCP wants to book a ticket, he would go to a Make My Trip, right? And he goes there because he finds value. If he wants to buy something, he would go to an Amazon because he finds value. And I think this is where the game exists, where whenever you're using a digital medium, you need to first think about what value would you create for the healthcare professional, and how he can use that to better treat his patients. And I think that is where the thought process started. And I think a couple, 4 5 years, since 4 5 years, this discussion has become easier. And like you said, we pharma as an industry is always considered a laggard when it comes to digital marketing. But I think a couple of years, the discussions that I'm having with all my peers and in my company, that acceleration right now has kicked off. A serious level of digital transformation right now is under the way. And I think the first foundation that needs to be built for this is building a great data foundation. And I think that is where a lot of big companies right now are investing in, to ensuring that you capture the right set of information, and then you will create all your strategies based on these data driven decisions that you would make.
Like data is quite important when we talk about the digital marketing, because you have to analyze the data, and on the weekly basis, on the daily basis, on the monthly basis, and you can deviate your strategy according to that. So how the data is important in the digital marketing, in like related to the healthcare or pharma.
See, I think data is critical when it comes to digital as a whole, independent of whether you are trying it in pharma space or not. All big companies who right now are boasting their great omni-channel engagement strategies have built it on their data. So identifying the data that you can use, storing it in a format that becomes more consumable, and then trying to create connecting the dots between different data sets that you have. When you talk about a digital transformation journey, I think the first step is to identify what channels you will use, what kind of data would you generate from that, and how you will use the data to further plan campaigns on that. Then you try to connect all these channels with each other to identify a customer journey across channels rather than on the channel itself. And I've said it before in some forum where people are very hesitant when it comes to digital in pharma, but I think pharma has a big set of information and data. I've worked in Salesforce effectiveness also, and I've worked in MIS also. So I know pharma sits on a huge pile of data. Now, what we have to do is identify how we can leverage this data to create models that can cater to our industry specifically. It will be difficult for pharma to adopt any strategy from any other industry directly, at least in India. It won't be possible because there are a lot of regulations, there are a lot of compliance that you need to take into account before strategizing anything. Having said that, pharma already has a great set of information. There are thousands of reps on the field continuously collecting data, continuously collecting information of what the doctor wants, and you really need to leverage that information. I always say this: a rep is the most important central point of your entire digital marketing price point. A lot of time people leave out the rep, but I think has to be the center of a digital marketing. He becomes a great source of information and data regarding your recipe on a very real time basis on a ground level. And you can use these informations to create as minute segments as possible, and then you can have your strategies accordingly delivered to those segments.
Would you mind elaborating a bit more on this omni-channel strategy and how we can implement, how effectively it can be implemented in pharma industry?
Fair. So see, digital goes in three ways, right? It starts off with start it starts off with usage of multiple channels, where you try to identify your channels your customers are on, or you want to bring those customers on those channels, and then you start running campaigns on those channels to reach out to your customers in those channels. Once you have a great engagement on those channels, you try to create what is called as a multi-channel campaigns. Multi-channel campaigns are nothing but you use all these multiple channels, you try to connect the dot and try to create an experience that flows from one channel to another channel. So when you talk about reach, you create a plan where you distribute that reach amongst multiple channels. Once you have a mature model, I think right now India Pharma is somewhere around in the multi-channel engagement phase, where companies are using webinars, companies are using emails and SMS and all other channels that are handy today. But right now, these and you're analyzing them on a cumulative level, not in silos. So that I think has been a great leap for pharma industry in India. But the next step that exists right now is the omnichannel engagement. Omnichannel engagement is letting the customer have a seamless experience across different channels. The challenge that we have today is, let's say I send you an email A about topic A. My SMS may or may not speak about A to you. So when I'm planning an SMS campaign, you get on the topic B, or I'm sending you a digital campaign, then I'm talking about C. So there is no seamless experience for the customer. Although you're providing them information, although you're providing them with critical data that they can use for treating their patients better. But what omnichannel engagement talks about is creating a seamless experience. If I have to give a layman's example, for example, if you're shopping on Amazon and you put something on your cart you're shopping through your laptop, and then you put something in your cart on the laptop itself. Next step, when you pick up your app, Your cart is updated as per what you did on the other platform. Next time, let's say you have multiple phones. You take a second phone, you pick up from exactly where you left on the last phone itself, right? So this is called an omnichannel experience, where you try to let people pick up from where they left on the other device. So similarly, the kind of models that can be, so we don't have a point of purchase like Amazon, right? In Pharma. So what we can do is we can keep a track of what kind of information has been consumed by the HCP on, let's say, on your email. You see, I send an email to 10 people, out of which 3 people read that email. And I know what they have read on those 3 emails. Then these 3 people, I should not be sending what I sent to the rest 7 people again. So repeat of information. So what I can try to do is when I plan my next campaign, I send a customized content for these to these 3 people, and remaining 7 people who have not read my email, I try a different channel to send out the same communication. So instead of having a linear flow of experience for the customer, you create a matrix where you identify on each customer level or on a segment level to start off with, to identify what kind of information they have absorbed till now, and then you pick up from there and not follow one solution to all. So you can't be sending out one email to all the people all the time. You need to start customizing your content. You need to ensure and be vigilant on what your customers have engaged with, and you take them ahead on their customer journey and not just spread out blanket information to everyone.
Like you said about like email marketing strategy, like I have to discuss a like a e-pharma startup 1mg, which are also like creating a great impact in the with their email marketing strategy. What I observed with their strategies, like they are sending you the newsletter, also offers which are like the season sales and all. But in the newsletter, what they are providing a content, like they are mostly focusing on the content strategy, that if they are sending a newsletter of the hair loss strategy, then with a hair loss strategy content, they are providing the multivitamins which are using in the related with the hair loss, and the oils, the shampoos. So like not directly connecting with the product, but indirectly connecting with the product, and like it helps them to create a strategy with like according to the disease, and according to you are telling all the customization of the email marketing. So they are leveraging the email marketing strategy according to that. So sir, can you just tell us about these things, sir? How you can customize these things according to the your audience, sir?
See, where it starts is before you send the email. A lot of work, a lot of smartness that you do for your campaigns, irrespective of what channel you're using. But now that you've mentioned email as an channel, I've used that as an example. A lot of work, a lot of decision whether your campaign will succeed or not is done when you're planning the campaign itself. So in an email campaign, in an email or any other campaign per se, what you really need to do is first segment and identify your customers on those channels. You can't be sending email to all. Let's say you have 100 customers, you can't be sending out email to all 100 of them. Maybe not all of them would be reading an email, right? So you need to identify which customers are of yours are religiously reading your emails. There are some customers who seldomly read emails, and there are customers who don't use email as a channel at all. So it is no use for you to send out that email to those guys. Then you identify these set of customers who are not reading your email. You try to identify from your other data source whether they use any other channel or not. Or there can be a set of customers who are not digital at all. You need to be in alignment with this reality also. Right now, you will have a good number of customers in your list who are not digitally savvy. They will not respond to any digital. So you need to create strategies customized to this. For example, if I'm sending out an email to people, I don't send out to everyone just because for sending out sake. It is not wise. I mean, it will look good that I am sending email to 100 people every time I send out, but if people don't read that email, my readability also keeps on going, because then it will not land in my inbox. It will land in my junk. So there is a risk of this email landing in the junk of an person who reads email. So you exclude people who don't read or interact with you on those channels, and then you create your strategies accordingly on people who read your email, who continuously read your email. They need to be treated differently, and people who seldomly read your email and use other channels also to interact with you, you use a different strategy for them. So one rule that can apply to all doesn't exist nowhere in digital. And I think Pharma also needs to really adopt that and work a lot on having smarter segments.
Sir, like you are telling about the different channels, can you list the channels where which we can leverage for a good marketing strategy?
See, honestly, right now there are not many campaigns that pharma companies send out directly to patients, right? So the model in India that revolves around is you provide relevant information, relevant data to the HCP to let him decide what works better for his patient. So reaching out to patient in some scenarios where maybe there is a patient awareness campaign or a patient uh, adherence program, in that case it might work, but that is not very prevalent in India as of now. So right now, the communication that pharma companies mostly do is with the healthcare provider. That is the model in pharma in India, where you send proper information, proper communication to the HCP to help him with more relevant information to help him treat his patients better. Rather than marketing your products, it is wiser always to let the HCP decide according to his discretion what works better for his patient. And in order to let him take that decision, more informed decision, you send out unbiased information to him so that you are not trying to misguide him or you are not trying to uh, influence his decision. You just send out unbiased, proper information to him, proper data to him that can help him have make this decision better. So when you are creating a campaign, uh, identify your customer. Like I said in the past, identify your customer, who your doctor is. You can right now industry does segment the customers being healthcare providers on the basis on their specialty. So you tag them to a specialty, you send only relevant information to the specialty. There can be micro segments under that to identify their digital segmentation, their level of experience. Let's say there's a new doctor, he would require a more basic level information. There's a doctor who's been practicing for 20 years, he doesn't need any basic information, right? So you create micro segments to identify what information would be relevant to him, identify the kind of treatment and past information that he has access to, and you create that smart engine where you create a suggestion engine to your marketers to have this better level of segmentation and micro segmentation to ensure that you're only sending out relevant information. Otherwise, doctors today meet hundreds of pharma companies. If each company plans to send one email in a week, it is like 700, 800 emails in a week. And doctors will lose information in that. So it is important for the entire industry to be very wise while sending out information. Only send out, don't send the communication for sending sake. Send out information only that is relevant, send out information that is smart and segmented and curated using data. And then it really works wonderful. It has really worked wonders for me. And I think it has to be a guru mantra for everyone.
Sir, can you tell more about the channels which pharma company leverage? Like, despite the like email marketing, like they can also leverage the YouTube marketing and Instagram, social media. Also, they can use. Not like we can say connecting with the doctors, like they can connect directly with the patient to for a brand building. Not like real customers is like doctors for a pharmaceutical company, but for the brand building or like for the brand awareness, they can directly connect with the patient with the connect content marketing with the help of Facebook and Instagram and YouTube and all we can say the podcast.
Sure. See, whenever a pharma company, I believe, plans a campaign, they need to ensure that they are putting patient at the center of everything, right? So there are certain information that you need to give to the HCP to pass it on to the patient, and there are certain management info content that you can create that can really help the patient to manage their disease better, which is not scientific, which is not medical in nature, but that is day-to-day information that a customer can or your patients can use to ensure that they are living a better life today and they are managing their disease better. For example, in diabetes, a diet plan really helps in diabetes. And if you can create that repository of information that gives out a medically approved or a more generic, a medically approved, or I won't call it medically approved, but more of a scientific diet rather than they listening to 10 different people. So I had family in my diabetes in my family, right? So before I got into this, so when I was small, we heard a lot of things that people should eat when they have diabetes. And that information came from places that are not credible. So some grandmother in the village used to give information, say eat this, and then there are some neighbor auntie used to go, "Arey, iska powder bana ke kha lo aap." Uh, so this information is not credible. But right now, as there was no information right now easily accessible in that time to people, people used to listen and believe everything that you said. Today, right now, I think HCPs and pharma companies have that power to give out credible information outside. Put it out there on your website, put it out there on your social media handles, put it out there on YouTube, create podcasts that can help people manage their disease better, which doesn't have to do with medicine, but have to do with their day-to-day management. And which people before this used to ask 10 different people in their family. Now it comes from a organization or an healthcare professional or people like you and me who have been working in this domain for some time. And now the information that we put out has been vetted by a lot of people, credible people. And I think that is the kind of content strategy for brand building. And what will happen? So your objective should be patient safety and patient disease management first. And I think brand will build automatically when people find value in whatever you are posting.
So talking about marketing and sales, we already know that the pharma industry itself is having a very unique pattern of sales and marketing. The very basic, about the MRs working on ground and having face-to-face calls with the doctors. So how you think this digital marketing strategies is going to bring an impact on the face-to-face calls of the MRs with the doctors and these kind of these conventional kind of strategies in marketing?
Right. So I think, like I mentioned in the past, right, some time back, is I always put the rep at the center of all my digital strategies. My digital channels that I'm implementing, or any digital strategy or an omni-channel strategy that I'm building, needs to complement everything that the rep is doing right now on the field. So right now, after COVID, access to HCPs have become less. And it has become a great channel to get that face-to-face interaction. So earlier, when a doctor used to meet me 3 times, right now he's meeting once every 2 months. But I can't lose my share of voice in that event, right? So when you are creating a digital strategy, this is what I advise and suggest everyone, that you need to put your patients and as well as your rep at the center of everything. So patient is the one who will receive the all benefit of everything that you're doing, and rep needs to be the one who gets complimented for all his efforts that he's putting. So right now, a lot of rep-driven digital channels are also in place, where people have e-detailing in hand. They are sending privatized email to SCPs, rep-triggered emails to SCPs, and there are a lot of webinars. And right now, due to COVID, I think face-to-face video calls are also happening between reps and SCPs. So right now, the rep is equipped with a lot of digital power in his own hands, and I think all the reps have adopted it well. I think the pharma industry has adopted it really well. And what has happened is right now it is moving into a new model for marketing and sales in pharma, where nothing works in silos. So the rep and the sales team works very closely with the marketing team to ensure that the content that we are creating is smart in nature. And the rep is, so earlier only the marketing team used to use the digital channels. So all digital channels used to sit in the HO and field was on the field. But right now there has been a good synergy between these two, where webinars that are being run, or emails that are being sent out, SMS that are being sent out, video calls that are happening right now. Rep plays an important part into whatever is happening right now. And I think the next model of pharma marketing would be a very smart or very digitally savvy rep who would lead this from the front, and every other support team that is there in the organization would complement to all efforts that he puts into engaging the HCP.
What will be the next big thing in pharma digital space? Can you tell me a little bit about this?
So right now, at least in India, I think what we are not using right now is other digital channels that other industries are using, like Google Display Network, digital ads. Social media right now is not being explored as much as it can. So I think the next big thing is going to be an omni-channel campaign from pharma companies, where we are also leveraging these channels. Right now, I realize that there is a lot of complications when it comes to compliance and regulations. So that formula still needs to be cracked on identifying how we can do that while being in compliance with all the regulations that we have in the country. But I think that is where the exploration is going to go, where we will identify models that will work within the compliance and still be able to leverage all these channels that other industries are using and we don't right now.
Like sir, you talked about like social media. So I am also the like quite observer in the social media thing in the pharma industry. Presenting a presentation in an like conference about how digital marketing going on in pharmaceutical industry. So that time the meme marketing is going on in the pharmaceuticals. So like Dabur company for their OTC product, they introduced a meme. Children is telling about the travelers that wear mask. So they introduced a meme where they are telling about ki, firstly you are telling the children about the wearing mask, and then children is telling you about wearing mask. So the baat kuch hazam nahi hui, so take hajmola. So that is the product tagline, and I'm quite impressed with these tagline. Like the copies, or we can say copywriting, also a great part in the digital marketing efforts.
See, it is, and I think if it has to start, it will start from OTC. I would see it coming to pharma HCPs, right? Because the relationship between a healthcare provider and a pharma company is little different than a consumer and any FMCG company. So I think if there's an onset of this, I think it can happen between a pharma company for its OTC drugs with its patients. But I think the relationship that an HCP has with the pharma company, right now there is no space for it right now because the relationship is more scientific in nature. I remember 4 5 years back there was a lot of buzz around gamification that you need to introduce games, you need to introduce games. So there were two ways it went. So one, people who took gamification very seriously. So they started building games. So I saw one game which was a replication of Subway Surfer for the HCP, and there was brand logos and the characters to run and jump and collect logos. And I did not see the purpose of it. I did not see how it can be used. What we did at GSK was created a we used gamification, but what we did in that scenario is to see how gamification can be used to give out important scientific answers and important scientific studies out to the customers, to the HCP. And the gamification approach that we took is we started creating quiz apps. And on quiz apps, an HCP can go and test his quiz and information on that specific topic by answering quiz. And there was a leaderboard where you gamify that entire process where people know whether you're in the top 10 in the country or knowing all these answers. And this was an extensive list of medically vetted information so that there was no layman information on the platform. The platform was vetted by top medical professionals and the compliance and regulations of the organization. And at the same time, uh, it allowed HCPs and so it was not for advanced level HCPs. It was most for I think for postgraduate PG doctors. And for PG doctors, it was easier for them to revise everything that they are studying. At the same time, you have a gamification angle to it where you have a leaderboard where you know how well you're faring as compared to everybody else in the country who is using this app. And then at the same time, you're delivering information, you're delivering scientific information, and let people test their knowledge also. So this was the direction that I felt is more suitable than creating a racing game or a jumping game on a mobile rather than you use an approach. So gamification really works is what I feel, but you need to be smart about how you're using gamification. You can't be putting running games on an actually doctor's mobile because doctor has to treat patients. He can't be running. If he has to play a running game, he would play Subway Surfer or Temple Run because those games are much better than what you can build. You are not a tech company. Those companies are tech company. They can build solutions. So you need to identify what is your area of specialty. Our area of specialty is having great scientific information, great scientific unbiased information, and then leverage that. We can't be building apps, AR, VR apps also that are more gimmick in nature. So that will come and go. So identify what is your strength area, then see what technology you can use. A big problem that I've always seen is people have ambition of using a technology, then they try to create a solution around it. You should be vice versa. What is the solution you want to deliver? What is the information you want to deliver? Then you map it with the technology that you have in hand. So I'm not saying AR, VR will not work, but you first have to identify what message you will put out through AR, VR. A lot of people want to do AR VR, then they backtrack that what you will say on AR VR. First, identify what you want to say, then identify what technology works. Maybe a gamification will work, maybe a VR app will work, maybe an AR app will work, maybe a simple email will work in this scenario. but you have to go this way: identify the message, then the platform, not the platform and then the message.
At the end of this podcast, like I want to ask how a fresher can be go through this digital marketing journey.
Okay, so I think this suggestion that I give to everyone: read a lot. There is abundance of information on the internet, which will not cost you a single penny. So you can go through it, or people can listen to podcasts like yours to get some understanding and information of a lot of aspects that you have covered through a lot of episodes that you have created. And I think once it starts, once you feel that you have sufficient information, you've read sufficient information, then when you start working, you can start getting involved into basic digital marketing activities that are happening in the organization. Observe before you start delivering. Observe how. So I'm definite there will be a lot of people in your own organization who would be great at digital marketing, right? So observe and learn from them. Try to pick up projects where you can assist and you can deliver and learn. So give as much as you can take, so that it becomes a good symbiotic relationship with whatever you're working at. And at the same time, once you feel you are comfortable with all the bookish knowledge as well as hands-on experience, you can start building your own digital marketing models that you can implement to answer the challenges that your brand or your company is facing.
Thank you for teaching us a bunch of things from your like experience, sir. Thank you so much, sir, for the podcast.
Thank you, Lokesh. I think the initiative that you guys have is great. I think we don't have that in the pharma space, and I hope you create a lot more episodes. And I also get to learn from a lot of other people that you bring on the panel. I think it's a commendable job that you guys are doing here.